Welcome back to Healthcare Insight on America's Web Radio. We're going to start to get into details and build the actual system and how to create it and how consumers can access a better health insurance program. Find those programs that are actually available out there to the varying degrees of what we've been talking about and what we're going to outline as we move forward. States willing to pass consumer empowering and appropriate healthcare legislation will reap immediate benefits, immediate relief from Obamacare and set a foundation consistent with the eventual passage of any federal private market reforms, which is coming. We're either going to go one direction or another. We're either going to go to a nationalized healthcare system, single payer, Medicare for all, if one party gets in power. And if the other party gets in power, we're more likely to have to face the reality that Obamacare is in a death spiral and that we've got to do something to replace it with a private market reform. Those seem to be the only two choices at the moment. That or delay is not an answer. Delay is only going to mean that Obamacare dies and nothing is put in place. Delay is only going to mean that the public is going to have an outcry for the federal government to do something, even if it's not the best choice, because the general public doesn't know or understand all the complications, the results that may come from a government-controlled system. So we've got to do something. That's the long-term vision, is to pull everything together. The short-term is to get something passed to actually replace Obamacare. So let's get into the real details of how this all is going to work. So let's be clear on private markets versus socialized medicine. Those seem to be the two directions that we're heading. Well, in 2018, a survey showed that Americans prefer private health insurance solutions over expanded government control of health insurance. 71% of Americans are satisfied with their current employer-provided health coverage. Socialized medicine and government-controlled health insurance is seductive. The concepts of expanding Obamacare to socialized medicine are simple to explain to the voting public. Socialized medicine is generally promoted as everyone having equal access to universal care. The reality for patients is equal delays and limited services for all in need of treatments. Americans have little knowledge of the problems, restrictions, limitations, time delays, poor quality of facilities, and limited services in a socialized system. Well, I have studied the German socialized healthcare system. I was invited a number of years ago by Angela Merkel to come over and look at the system with a group of other actuaries and healthcare experts. And what we found is the terms solidarity is frequently used in praising government-run healthcare. In Germany and other European countries with socialized medicine, the reality of solidarity is a false concept. Government officials, unions, teachers, and other favored groups have access to better insurance and health care than does the general public. The Joe Sixpack, just sitting back and needing health care for himself or his family, is not given the same coverage as somebody who is in one of these preferred groups. A recent Reuters poll found that Americans initially supported Medicare for all, 56% to 42%. That's a pretty good majority, and I think that's what's driving a lot of the 2020 presidential election debate around Medicare for all. But that same survey found that once people are told that a government-run system could lead to delays in getting care or higher taxes, support for Medicare for all plunged from 56% to 26%. So the message here clearly is that Republicans better have an alternative, better have an answer, better have an explanation for the impact of a Medicare for all system and how a private market system could really get people the health care that they want. Everyone knows that the United States spends a larger portion of our GDP, our gross national product, than any other country in the world. That sounds bad and resonates as a negative across political lines, with fiscally conservative voters. But existing U.S. government-controlled programs exemplify out-of-control spending, waste, fraud, abuse, and the lack of modern technology. The government is, in fact, today, the largest payer for healthcare services. The VA system, the VA healthcare system, where military service members can wait for years for office visits and need care. President Trump has at least signed an executive order to allow private market alternatives for veterans. That's going to help a lot. Everyone over 65 is in Medicare. It's required. It's mandated by law. But Medicare is rampant with fraud. The coverage is so inadequate that Medicare supplement policies are needed. If you're over 65 and don't have Medicare supplement policy, you're not going to get the kind of coverage and care you need. And the greatest concern of anybody over age 65 is outliving their assets. So you need a Medicare supplement in case you're one of the few people who has something that keeps you in the hospital beyond the 150-day limit that Medicare provides for. The Trump administration is promoting and supporting the private market alternative called Medicare Advantage. Medicare Advantage covers 365 days. It covers many more things than does Medicare. It's a private market alternative to Medicare. It's allowed as a replacement for Medicare, and it gives you more benefits, typically at lower cost. It does depend upon your geographic market, where you are, as to whether or not insurance companies have been able to develop that private market alternative, but they're generally available through most of the country, and it's usually a much better deal. Medicaid, let's talk about that for a second, is typically considered insurance for the poor. Medicaid may be the worst possible option for insurance. It's been on the government watch list of the most fraudulent program for decades, but in spite of its many flaws, Obamacare expanded government-controlled Medicaid. So you put all that together, in 2017, the federal government, paid about 43% of all healthcare expenses in the United States. Of the $3.5 trillion spent on healthcare, about 18% of GDP, $1.5 trillion is directly or indirectly financed by the federal government. So the real debate is, what do you do with the 200 million people that are in private insurance? Are they going to stay there? They have new options? Is something going to be created to support that market? Or are they all just going to go into government programs? Well, the practical political debate is not over eliminating government involvement in health and healthcare insurance. The debate is over the growth versus the limitation and reduction of government controls. So let's talk about employer-sponsored health insurance now. 60% of Americans, or 176 million, are primarily covered by employer-sponsored, employer-subsidized health insurance. And individually purchased policies are generally 10 to 15 million, roughly 11 million, but up to 15 million. It's hard to get a full count on these because many people have coverage in both areas or have multiple policies. So the numbers are a little bit different according to what source you go to. And you know, the main argument for Obamacare was to solve the 47 million uninsured people that the country faced in 2010. It's one of the big arguments for Obamacare. But today, under Obamacare, 28.5 million remain uninsured. So the Affordable Care Act, while it successfully expanded coverage about 18 million people, it did it mostly by expanding Medicaid in many of the states that took advantage of the Medicaid expansion and the government funding of that. Other states said, we don't want to expand Medicaid. What we have already is problematic enough. It drains our state coffers. We can't do education. We can't do road repairs. We can't do various other public service projects because Medicaid is just soaking up all of our state dollars. And while the federal government was willing to pay 90% of that increased cost, the concern was what happens after that money runs out? What happens when the federal government changes that? Does that burden go back to the states? Can they really afford it? Because once you provide the benefits, you can never take them away. So they're looking for an alternative answer, something that instead of having government subsidies, can we create private market subsidies? So 176 million people with private insurance were unnecessarily swept into the Affordable Care Act with its burdensome government rules, regulations, benefit mandates, and pricing increases. So we are all affected by Obamacare one way or another. Some more impacted than others, but we are all impacted by its rules and regulations and mandates and requirements. Major financial flaws in Obamacare included distortion by age and forced plan designs. We've talked about this before in other parts of the broadcast. It forced young people to pay more so that older people could pay less. It forced the purchase of coverage that not everybody wanted or needed. It colluded with insurers by guaranteeing insurer subsidies for any insurance losses that they might occur. That's why you didn't hear an outrage from the insurance companies saying, you're taking away my private market options. You're taking away my freedom to sell in a market. You're now creating all these government controls. There was a devil's deal that was cut between the government and insurance companies to say, you offer this, and if you have any losses, we'll subsidize those losses. Don't worry. The debate will likely be resolved through political process of elections. If Democrats control Congress and the presidency, the country will move in a direction of expanded government insurance, Medicare for all or single payer. Democrats' version of private health insurance would involve more Obamacare subsidies, increased regulations, and expanded Medicaid. If Republicans control the power in Washington, D.C., then the private market reforms will allow for repeal of the ACA, large group regulatory relief, something I call certificates of guaranteed coverage, which we will describe shortly, and the impaired health support group, again, part of the overall health reform that we're going to outline. So here we are again at the end of our second hour. We've covered a lot of material. We've covered all sorts of things from basic principles to expected outcomes to trying to describe the market as it exists today, socialized medicine versus private insurance. I think if you stay with us, come back for next week's session, we'll actually finally get into the real nuts and bolts of healthcare reform, how to create the private market. So if you're listening to this, if you're following this, I hope the foundation has been laid, the basic concepts and principles and reasons for why we need to have private health insurance as Obamacare dies, as the election approaches us. What are we going to do about healthcare reform? How are we going to get the things that we need in order to protect ourselves and our families from the financial ruin of healthcare expenses? How are we going to get the things that we need to maintain our health for the well-being of ourselves, our families, our society? Stay tuned. We've got a lot more to cover and a lot more detail. I hope you're enjoying this. Come back to America's Web Radio next week and look for Healthcare Insight. Thank you again for joining us. Look forward to hearing from you during the week and being able to talk to you next week. Thank you.